At ValueMed, we know every senior's journey is different, with diverse health concerns along the way. We strive to manage seniors' complex medication needs and help reduce the burden on caregivers, families, and residents so they can focus on what's important to them.
Medicaid is extremely important because it covers about 2/3, a little under 2/3 of the individuals in skilled nursing facilities in Ohio. There's also a growing number of folks in assisted living who are on Medicaid, including my mother. Because of that, it really plays an important role. And what we found is that inadequate Medicaid reimbursement, which is true in most states and is certainly true in Ohio, has a direct link to quality. And the way we discovered that was some interesting data that were published last year by the administration when we were fighting with them over money, and they wanted to try to embarrass us. But in the process of doing that, they put out data that showed that we're actually getting $23 a day less in our Medicaid rates than in cost, and then the services cost on a per day basis. AHCA has put out studies year after year with that, but it is from AHCA. This was from the state of Ohio. So we made hay with that. We also found from their data that there is a direct relationship between how providers do on the star ratings and the percentage of Medicaid that they have. And it's an inverse relationship, so that the more Medicaid you have, the more difficult it is to do well on quality, to do well on the star ratings. We thought that was a very compelling point.
And when you're here in Washington, you're obviously talking to federal officials in one form or another. Do you have to remind them there's a whole level of state regulations and state issues that you have to deal with as well, or do they understand the dynamic of this dual regulation?
I think we always have to remind them of the fact that we're regulated and we're paid at both levels. We also have to remember, in Ohio in particular, that the provider tax is a significant issue. We are one of those states that has chosen to max it out, and so we draw down about $1.1 billion just from the skilled nursing facility portion, not counting what is done for ICF's IID and what's done in the hospital arena and the managed care plans. There is a lot of money that comes down from a tax on managed care plans.
Great.